Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
When was the last time you were looking for a full-time hygienist? And maybe you're looking for one now. And if you are, or when you were, was that individual tough to find? I mean, I know finding part-time hygienists may be a challenge at times, but it's usually a heck of a lot easier. But normally when you hear complaints about hygienist availability, it has to do with finding somebody who is full-time. It's definitely tougher, in some cases tougher than finding an associate. And maybe you thought, well, you just need to look harder or you need to put some more time into it, which those are valid arguments. But is this really a thing? Are there less hygienists than there should be? Well, I was doing some research recently for my upcoming presentation we have our annual event, the MGE Owners Conference, and I usually do a whole presentation sort of on the state of the profession. And I did a bit of a deep dive on just the subject of hygiene, hygienist availability, etc. And what I found was kind of interesting. It sort of answered the question, so I thought it would make a great episode. So for this week's episode, I'm going to share what I found. And it answers this eternal question, which is sort of on par with the meaning of life, which is, why are hygienists so hard to find? And I want to follow it up with what to do if you're having this problem on a short-term basis, as well as what are some of the ideas that are out there for the long-term solution to this issue. My name is Jeff Bloomberg, and I'm your host. And let me start with this simple answer to this question. Why are full-time hygienists, or just hygienists, especially full-time for that matter, so hard to find? Well, because on a national U.S. level, yes, there is absolutely a shortage of dental hygienists. Now, there are some regional aspects to this, and I remember the first time I encountered this was years ago, probably, close to 30 years ago. I was in the Chicagoland area, and I was talking to a buddy of mine who's a dentist, and he was mentioning that the current ratio at that time, this is in the early 90s, was there were 5 dentists for every 1 hygienist. So normally when your hygienist had to take a day off or you needed to call in a temp, the temp agency was sending over a doctor. It was very rare to get an actual hygienist. You got a doctor because there was such a shortage of hygienists. And you may have areas where there isn't a shortage of hygienists. And usually the best way to find this is if you go to Indeed and you're advertising for a hygienist, or you want to see what hygienist availability is like, look at what the hygiene ads say. If they have signing bonuses and they're paying $10, $12 more an hour than they were 2-3 years ago, you probably have a shortage of hygienists in your area. If you don't see that and the salaries look normal, then you probably don't. It's probably not a shortage area. So nationally, yes, there's a shortage, and I'll get into how I came to that conclusion here in a second. But regionally, there may be areas, you might be in an area where there isn't one. It really is all area dependent. All right, so let's take a look at the numbers. How did I come to this conclusion that we have a shortage? So let's first start off with the supply of hygienists. So I'm not going to read all these numbers to you, but let's start in 2015, we had a little over 200,000 hygienists. By 2017, we had 211,000. 2019, we had 221,000. This is in the United States. So 221 in 2019. In 2022, which is the most recent numbers that we have, there were 214,700. This comes from Becker's Dental, where it explains the numbers breakdown. Okay, so all in all, look at just those 2 data markers from 2019 to 2022. We've actually lost 7,000 hygienists. We're down to 214,000. Now, that number in and of itself in a vacuum with no other data really doesn't mean anything. So let's compare it to the number of dentists we have and kind of get an idea of how many hygienists should we have. Well, right now there's about 203,000 dentists in the United States. 21% of those dentists are specialists. So in most cases, maybe in a perio office, and I've seen the occasional orthodontist who has a hygienist, but for the most part, you're not going to get a lot of hygienists working in specialty offices. For the most part, they work for GPs. So if we have 203,000 dentists and 21% are specialists, that leaves us with 160,000 GPs. So we have 160,000 GPs, and we have 214,000 hygienists. Again, on its face, that doesn't look so bad. Till we take a look at, well, how many hygienists per dentist, I guess is the best way of saying it, should we have? Well, let's first take a look at something. And I've done this in numerous episodes about building your hygiene program. You need to. If you have a general practice, it's sort of a natural factor of expansion if you're retaining patients that your hygiene program is going to grow. And I think I threw some stats out on a prior episode where if you were to start a scratch practice getting 30 new patients a month, you should be, and you're retaining your patients, you should be adding 1 to 1.4 days of hygiene per week per year. So after year 1, you should have 1.4 days a week of hygiene. Year 2, you should have almost 3 days of hygiene. Year 3, you should have a full-time hygienist. By year 10, you should have close to 10 days of hygiene. This is starting from scratch 10 years later with 30 new patients a month, which is not a huge amount of new patients. So if your practice is sort of growing geometrically as you're retaining patients, and you have 2 hygienists, eventually you're going to hit a point where as a doctor, it becomes inefficient. You have too many hygienists. 1 to 2, 1 doctor to 2 hygienists, in my opinion, is inefficient because the doctor in certain cases may be gloving and degloving several times per hour just to do exams. Usually the ideal sort of sweet spot ratio we found is 1 to 1.5. So if you have a doctor and 1.5 hygienists, that works. If you have a doctor and 3 hygienists, that's not going to work. You probably need 2 doctors at that point, doc and an associate, okay? So being that if you have a GP practice, it is a natural factor of life that your practice should just grow if you're retaining patients, there should absolutely be more hygienists than there are doctors, ideally 1 to 1.5. So if we have 160,000 GPs, how many hygienists is that? That's 240,000. Right now we're at 212. So we're already almost 30,000 short right there. And let's assume out of these 160,000 general practitioners, a large portion of them are full-time practitioners. Of course, some are going to be part-time. For the most part, they're full-time. But what about hygienists? See, this is where it gets interesting. In a survey by Dental Post back in 2022, it found that 40% of hygienists in private dental practices and 31% of hygienists in corporate dental practices worked part-time. There was also a study done by the ADA Health Policy Institute in collaboration with the American Dental Assistants Association, Dental Hygienists Association, Dental Assisting National Board, and Ignite DA. And it found, and it was quite a mouthful, sorry folks, that 53.7% of dental hygienists work full-time, 32 hours or more per week. So if you take that 212,000, a little over 50% work full-time. So let's say, 120, 130 work full-time. That means that the rest work part-time. The actual statistic here was a little bit funny because 53.7% work full-time while 28.8% work part-time. I don't know what happened to the other 19%. But at least 30% of hygienists work part-time. That's 60,000 hygienists are working less than 32 hours a week. So we're already short 30,000 hygienists, and 30,000 or 30% rather of the ones that we do have are working part-time. We then move on to hygiene demographics because the idea is like, okay, if we're already short hygienists, well, are we going to be getting a bunch of new ones here soon? Well, not enough, and we also have a little bit of a situation with the demographics. The demographic data as far as age for hygienists is not as robust as it is for doctors, but here's what I did find. So the average age for hygienists for male hygienists is 43.3, female hygienists is 42.2. Okay, so the average age of hygienists, if we take a look at that, I don't know what the male to female ratio is. It's really not that big of a deal to me. They're both hygienists. Let's say it's in the 42 to 43 years of age range. Now, 40% of the hygiene population is under 40, which means 60% is over 40 with an average age of 49. I'll say that again. So 40% of those 212,000 hygienists are under the age of 40. The other 60% are over 40. They actually have an average age of 49. So we're at a point, if you take a look at working years, and again, I'm not practicing ageism, as I've said before, I'm over 49. The point being is that if somebody's 49, if that's the average age, they're not planning on working another 30 years. That's just not where they're at. Someone who's 25 might be. So we have more than half of the hygienists that we have in the U.S. that are well over 40, closer to 50 years of age on average. All right. And then there was a survey done as part of this same study by the ADA Health Policy Institute and the Assistants Association, Hygienists Association. And one of the survey questions found that 1/3 of dental assistants and 31% of hygienists plan to retire in 5 years or less. This is all good news, isn't it? So if we take a look at the workforce here for a second, sort of the summary. We have about 214,000 hygienists. 42% are under the age of 40. 58% have an average age of 49. That's 116,000. And on average, many hygienists retire before the age of 65. So you go, okay, we have a lot of people exiting the profession at some point over the next, 5, 10, 15 years. Well, how many people do we have coming in to replace them? Well, here's where we get into the problem. Here's the rub. The average number of graduates from hygiene school per year is between 8,000 and 9,000. As a matter of fact, the last 3 years, it has been going up. It was actually averaging a little over 8,000 going right into 2020, 2018 to 2019. Into 2020, it was like 8,200, 8,300 a year. It dropped in 2020 under 8,000, and now it's ramping back up to where last year, I don't have 24 data, but the 2022-23 school year, we had 8,600 hygienists graduating. But the problem is the number of graduating hygienists, the people entering the workforce, will not keep up with the number of hygienists that we possibly have leaving the workforce, especially when you consider how many of these hygienists tend to go part-time. As a matter of fact, to maintain the hygiene workforce at this point in time, and to have modest growth, we'd need to be graduating about close to 12,000 hygienists per year, about a 40+% increase. So that's what's happening. We do have a shortage. There is a shortage of hygienists. As I said, regionally it may be different, but we are not producing enough hygienists to keep up with the exit rate that's being projected here over the next few years, as well as just to keep up with the number of dental professionals that we currently have. So the question is, let's say your practice is growing and you don't want to stop that growth. You want to be able to add hygiene days and things of that nature. What do you do to find a hygienist beyond what you'd normally do, place an ad and things like this? Let's say placing an ad just isn't working. You can always sort of put it together between a couple hygienists with a couple part-time people, and as long as you train them well, you can that can work. Maybe you don't get your full-time person, but at least you have your days covered. The other things you can do is, obviously, if you have a hygienist, let's say you're in the state of Florida like I am, and you're in the Tampa Bay area like I am, and let's say there's a shortage of hygienists in this area. Well, what I might do is advertise throughout the state. If I go to Miami, there may not be a shortage of hygienists. The relocation costs wouldn't be terrible. And if I find somebody that works, I could bring them up, have them stay in one of these, short-term residence type hotels, like a Residence Inn for a few weeks to see if they catch the vibe of the practice and we're doing well together. And if they do, I can pay for their relocation costs and bring them up to my practice and work out some type of an agreement in that regard. Maybe the area you're in is tight, but outside of your area in other parts of the state, it is not. And that works the other way too. You might be in a rural area, maybe upstate New York, and you're having trouble finding a hygienist, just like an associate. Well, you can advertise in the city and you might find one and it's no problem. And this regional thing really is, it can really mess with your head to a degree. I remember visiting a client's office in Manhattan. This was a long time ago, 20 plus years ago. And where I was, we were in Northern Virginia at the time. There was a hygiene shortage. And I remember I'm in this doctor's building in Manhattan. It's one of these high rises. We have like 25 dentists in it. And there's this hygienist going door to door, dropping off her resume. I'm like, wow, that would never happen in Northern Virginia. The first office they'd go to would be like, you're not leaving. You work for us now. So there is this regionality thing. So if your area is tight, look outside your area for an area that's not tight. And again, to me, the most real-time data is looking on something like Indeed and looking at what's being advertised for. So again, if I'm in Tampa Bay, I'd look at Indeed in Miami and go, okay, it looks like hygienists down there aren't getting paid a lot. Why don't I advertise down there and move them up to Tampa? That's the first thing you might do. The other thing you could do is look for states that have easy reciprocity with your state. You can go outside your state. Let's say you're in, and again, I don't know the reciprocity laws for each state, which is a whole other issue in and of itself. But let's say you're in, Tennessee. And again, I don't know what the reciprocity laws in Tennessee, disclaimer. But let's say it's good reciprocity with Georgia. You might find somebody, let's say you're in southern Tennessee, you find somebody in northern Georgia that wants to move to Tennessee. You could advertise in that area, assuming that licensure is not difficult to obtain. Now, if you just can't find anybody, the solution is not to do the hygiene yourself. You're better off getting an associate, preferably a new grad, to do it until you can find one. And now, yes, that will be a little bit more expensive. The plus is in certain cases, if you're in a state that needs a doctor on site for the hygienist to practice, you don't need that if you have an associate doctor. That's a plus. The other thing is if it works out well and the practice continues to grow, that associate could eventually just start doing dentistry when you replace them with a hygienist. If that's not a solution, you can also do assisted hygiene. It's not my favorite, but it's better than, emptying your schedule out. How does that work? You basically have a hygienist working with a dental assistant, and the hygienist is doing the parts of the procedure that only they can do, which is usually anything subgingival. Again, look at your Dental Practice Act. Do not take what I'm saying as the law. You have to look at what's legal and not legal in your state. Full disclaimer there. But, I remember in certain cases, hygienists can polish above the gum, or not hygienists, rather, assistants can polish above the gum line. They can take x-rays, but the hygienist has to do the perio-probing and the scaling and things like this. So you kind of flip-flop. You have a hygienist and assistant working together, kind of flopping room to room to room to room, and that allows you to have your hygienist spend a half hour with each patient as opposed to spending a full hour. Something you can do. There's different ways to set it up. It all depends on your state and the Dental Practice Act. The idea is not to slow your growth. That doesn't work. So hygiene, if you're retaining patients, should expand. So you have to make sure that there's availability. You can't just go, well, I can't find hygienists. So that's the short-term solution. What is the longer-term solution for this? Well, the thing that's always confounded me is, why do we have a shortage of hygienists? It's a 2-year program, and it pays great. Someone basically is getting an associate degree, and they're making $40, $50, $60 an hour in some cases. You would think this thing should be full. Well, number one, there's not enough hygiene programs. So this is where you can talk to your local association, your state association, and you may hear that and just zone out when I say that, but let me tell you who you should talk to. Talk to your local and state politicians, especially your state politicians. Back during the pandemic, I remember, because everybody gets fascinated and fixated on national politics. And look, MGE is apolitical, irreligious. We don't take a particular position. We're all here about to help you improve conditions in your dental practice. But the one thing I found was, and I was guilty of it myself, I'd always get concerned about what was happening on a national level. But the problem is, what am I going to do about things on a national level? Not much of anything. But you can do things on a local and a state level. It's very easy to get a meeting with your state rep. It's very easy to get it with your state senator. It's very easy to get a meeting with your local county commissioner. That's not difficult. And these are the people who actually control where you live. So adding hygiene program availability, more education, more healthcare availability, especially if you're in a state with a shortage of hygienists, usually is something that one of these folks would be willing to talk to you about, your state senator, your state congressperson, and this is, or state rep. These are things that they can help push through with various schools. It's definitely worth your time. And it should be promoted as a fulfilling career, because it is. It's a good career. Another thing that could be done is accelerated tracks for dental assistants. Dental assistants, especially if they've worked in a practice for any length of time, have a degree of familiarity that they wouldn't have to learn initially when they started hygiene school. You might have shorter programs for dental assistants, assuming they've met certain benchmarks. They do this, and they've done this in one iteration or another in the state of Alabama for a long time, where essentially someone doesn't go to full hygiene school, and you could look up the program specifically for the exact how this works, because it's probably changed over the years. But they work under a doctor for a certain length of time. They have to take certain classes on infection control and things like that. And then they eventually get licensed as a hygienist after a couple of years. And they have to perform a certain amount of cleanings and things like this in order to do it. The problem is that license has zero reciprocity. You will never get licensed outside the state of Alabama for that. And then, funnily enough, you'd think with that in the state of Alabama, you would have just more hygienists than you know what to do with. They still have a shortage because they need a doctor to practice with, and there are not enough doctors in Alabama. Anyway, but that's something that could be done. The other thing you can do is just have a killer work environment. Have an environment where someone would not want to not work there full time. Which is, be trained, be well organized, do things like the MGE Power Program where you're creating a fulfilling environment where people are productive and things like this. I'll put a link to the Power Program on the episode webpage. Last thing I would suggest is maybe modernizing licensure. It's not as bad as dentistry, but reciprocity state to state for hygiene licenses are pretty rough. And there are movements right now that are in progress, as of 2024, 2025, sort of like the nurse licensure compact, where basically someone is licensed nationally, which would make life a lot easier. Because imagine this for a second. You have a hygienist relocating to another state for whatever reason. They're moving with their spouse because their spouse got a better job or something. Well, ideally, they should just be able to go work in a practice. Maybe they have to register or something or apply ahead of time and they do a background check on them. But assuming that they have a license as a registered dental hygienist, you would think they should be able to practice hygiene. So there should be better reciprocity. And those are things that you could push for, like I said, on a state level. These are easy things to pass. You talk to your state rep, and then they make it easy in your state to bring in hygienists. Funnily enough, Florida is notoriously bad for these things. Even as a dentist, you have to take practical boards if you come to Florida. You could be practicing 30 years and you have somebody watching you do a filling, Used to be on a person, now it's on a mannequin or of some kind. But you get the idea. If you make that, it'll be a little easier for hygienists to move or go to other areas if they want to. But ultimately, even if hygienists can move, we need more. So that would be anything you can do that you would want to do or take on in order to help create more, encourage more people to go to hygiene school or become hygienists, or make it easier for assistants to become hygienists, I think is a good thing. Anyway, not the usual episode this week. I saw this data and I found it fascinating because it's something I've heard off and on for years, so I finally got a chance to really look at the numbers. I found it interesting. It answered some questions I had. I hope it did the same for you. And even better, I hope it did give you an idea, rather, of how to work through this if you're in a shortage area, as well as actions you can do as part of the dental profession to help push to relieve this shortage. So that's all I have for you this week, folks. Again, like I said, kind of a different episode. If you have any questions about MGE, you can find us online at mgeonline.com or call us at 800-640-1140. I'll put a link to the MGE Power Program, like I mentioned a little bit earlier. Otherwise, on the episode webpage. Otherwise, folks, have a great week, and we'll see you the next episode.